Okay. Now you just have to listen. It'll make a little bit more sense. Every last one of us have a certain amount of cerebrospinal fluid, blood, and brain tissue. Most of us adults have about 150 cc's of cerebrospinal fluid. Most of us adults have about 1,500 cc's of blood. And most of us have a significant brain tissue, or you would have never made it this far. Those three can't go up or down. If one goes up, something else better come down. When we have a traumatic brain injury, a head injury, because this is not affected with an injury unless it's basilar, right? We agree? This is not the one affected with just an injury. This is going to be affected with lumbar puncture, so all of this is going to make sense in a minute. But it's not affected with a brain injury. So far, so good? What is affected? Either the blood or the brain. So when we say swelling of the brain, you guys know we mean cerebral edema, don't you? Well, there's a problem with cerebral edema, and this is where we're going with this whole conversation. With cerebral edema, the brain is swelling. So who has to go down? It's not going to be cerebrospinal fluid. That's hard to decrease. So what is it going to be? It's going to be the blood flow. Well, how are we going to do that? Well, we're going to shut it down, because you can't have everything out of order like that, out of balance. Now look, brain tissue swelling, vasoconstriction to the blood flow to the brain, and if you decrease the blood flow to the brain, you directly impact your level of consciousness. That's why you had to keep saying to yourself over and over, it's the first sign of ICP. So now you have brain swelling, you have flow of blood and oxygen to the brain going down, you have an increased ICP because of this crazy brain swelling, and when the brain swells, here we go, the ultimate complication of cerebral edema is herniation of the brain outside of the cranial cavity, which is crazy as hell, because you've got to do something here. So if you're getting this herniation of the brain, then you know you've got a lot less blood flow. Do we agree? Okay, so here we go. We're going to operate on that.